extraoral examination, we check skin, head, face, nose, ears, then TMJ, lymph nodes, salivary glands and lips and muscle of mastication. Coming to the skin. In the skin, we generally examine the color and texture of the skin. Then coming to the head. So coming to the head, basically there are three forms of head. One is the normal form is your mesocephalic, then dolichocephalic and brachycephalic. So we are inspecting these three forms, meso, dolicho and brachycephalic in the head. Then coming to the facial symmetry. Whenever there is any swelling, so generally we notice facial asymmetry due to the presence of that particular swelling. Then coming to the TMJ. So in the TMJ examination, we generally look for any deviation or any clicking or popping or grinding or any type of noise in that particular TMJ region. So TMJ, it is a temporomandibular joint. This is only a single type of joint which is present in the head and neck region, and it is present bilaterally in front of our ears. So TMJ examination we generally perform in two ways. In the first way, the doctor, they should stand in front of the patient, and with the help of these two fingers we have to put like this in front of the ears, and we will ask the patient to open his or her mouth. So by doing this, we are basically going to appreciate the clicking or grinding, any type of popping and any type of noises in this particular TMJ region. Or we can also check any form of deviation. Suppose if it is a case of any ankylosis or any pathology, if it is related to the TMJ, in that cases we see the deviation of our mandible to that affected side or of that pathological side. So we have to look for the deviation also. So in the first step we will stand in front of the patient and look for all these things. In the second step, we will stand behind the patient, and we will keep our thumb or the little finger, we will place it inside the auricular region or in the external auditory meatus region, and with the help of these three fingers we are going to place it over the TMJ, and we will ask the patient to open his or her mouth. Again we will check for the clicking or popping or any type of sound is coming from this particular region, or we will check for the movement of this TMJ. Now this was about the TMJ examination. The next thing which we are going to examine extraorally is our lymph node. So in head and neck there are various types of lymph nodes present, but mostly we are going to examine 7 types of lymph nodes in the head and neck region. The lymph node first we are going to examine is our preauricular region, which is going to be present bilaterally in front of the ears. Then postauricular, behind the ears. Then submandibular lymph nodes below the mandible, the base of the mandible. Then submental lymph nodes. Then cervical lymph nodes, deep cervical lymph nodes, and the occipital lymph nodes. So these are the major lymph nodes which we are going to examine in the extraoral examination. Now, lymph nodes are only palpable when there is any pathology, or if there is any presence of infection. Normally lymph nodes are not palpated. It is only palpated in case of the infection. Now the next we will move towards the salivary gland. So salivary gland, there are three major types of salivary gland in the head and neck region. The three major salivary glands are parotid gland, submandibular and the submental gland. Parotid gland, again we have to check for the pathology or any type of inflammatory or infections in this particular region. So for the parotid, again by digital examination we perform. We will do it in front of the ears, both the sides bilaterally for the parotid examination. Then for the submandibular, again at the base of the mandible, below the base of the mandible. Okay. Then submental in the frontal, in the anterior region, below the chin. Okay, this is for the submental region. Now, fourth thing which we are going to examine for the extraoral examination is our muscles of mastication. So, in dental or in dentistry, many patients accompany here with the chief complaint of muscular pain, okay, in head and neck region, okay, or with the case of orofacial pain or MPDS, myofascial pain dysfunction syndrome. So we have to examine four muscles of mastication. One is our temporalis, okay, then masseter muscle, okay. So these two muscles here, temporalis in the forehead at the lateral side of the head and the masseter muscle, okay. Then we have to look for the lateral and the medial pterygoid. So for the lateral and medial pterygoid, we are going to palpate it inside. Okay, for the lateral, we have to palpate from the vestibular region of our third molar till the posterior pterygomandibular raphe region. Okay, from the buccal side. And for the medial pterygoid, we are going to palpate it lingually from the posterior aspect of our third molar till the pterygomandibular raphe region. Okay. So, and the last thing which we are going to see in the extraoral examination is our lip. We have to see for the whether the lip is competent or not. Okay, we have to check for the lip seal. Okay, so these all findings we are going to see in the extraoral examination. We also do the facial profile, like we have to notice or we have to examine the facial profile. In the facial profile, there are three forms. One is straight, convex and concave. So basically we are going to look for the three forms of the face. One is the straight profile, convex profile and the concave.